Can you throw some light on nutrition, supplements, and immunity boosters for children during these times?
This is the most frequently asked question from parents, the supplements and the immune boosters. Firstly, there are no exercises, foods, or supplements that can truly boost our immune system. To boost our immune system is to make it work in an overdrive, and that is synonymous with inflammation and autoimmune diseases, and that's not what we are aiming for. Though many nutrients play a very vital role in promoting and maintaining a healthy immune system, it is to be noted here yet again that all these nutrients are present in our rainbow diet, that is, the 5 groups, the 5 colors, and 5 times a day. It is an evidence based guide which prevents an imbalance in nutrients. It is advocated, therefore, that you consume a variety of foods from all these 5 groups. Despite all this, I have seen in recent times that certain vitamins have garnered more importance, and parents keep asking about vitamin A, D, C, and zinc. Well, there was a recent study that showed certain immunomodulatory effects, favorable immunomodulatory effect of certain micronutrients in respiratory viral infections, and these were vitamin A, vitamin D, zinc, and some probiotics. But yet again, there are no clear recommendations about the requirement or supplementation of these micronutrients over and above that of our nutritious diet. All of us are aware that nutrition plays a key role in maintaining health. It becomes all the more important now than ever in such times that we have a balanced and a nutritious diet, so as to keep especially our little one's defense mechanisms working to its optimal best. We've all grown up looking at the food pyramid as our reference chart for a nutritious and balanced diet. Now, we've moved on from the food pyramid to what is known as the rainbow nutrition, where emphasis is laid on 5 colors, 5 food groups, and 5 times a day. The 5 colors that include green, yellow, orange, red vegetables and fruits, and the white, which stands for dairy. 5 groups which include the vegetables, fruits, grains, protein, and dairy. 5 times a day, that is to have 3 meals and 2 nutritious snacks, with an emphasis on reduced consumption of fat, sugar, and processed food. It is to be noted that 1/3 of our meal should consist of the grains, 1/3 of fruits and vegetables, and protein and dairy to constitute for the remaining third. Moving on to our first group, the fruits and vegetables. They are an important source of micronutrients, the vitamins, minerals, and antioxidants, which play an important role in the functioning of the intricate pathways of our immune system, thereby helps preventing infections and diseases. It also provides a body with fiber, which reduces blood cholesterol, helps in keeping our bowels healthy, and aids digestion. It is to be noted that this group contains less fat. Moving on to the second group, the grains. This group is known as the fuel station of our body, as it provides us with sustained release of energy. It also provides us some fiber, some amount of calcium, iron, and vitamins. So it is important to include whole grains and reduce the consumption of refined grains. Whole grains like brown rice, whole wheat pasta, whole oats, multigrain bread, and a wholemeal breakfast. Moving on to the third group, the proteins. Now, this group is known to be the building block of our body, especially the bones, the muscles, the skin, the blood, hormones and enzymes. It also helps in the repair of these tissues. The important sources of proteins are meat, chicken, fish, eggs, dairy, soy-based foods, nuts and pulses, which includes beans, peas and lentils. The fourth group, that is the dairy, they have impressive levels of calcium and protein and some amount of vitamin D. Calcium, as we all know, is important for our bone health. So including milk, curd, cottage cheese, cheese and butter in our diet on regular basis is very important for our bone health. Some amount of fat is important in our diet, and drinking adequate amount of water and keeping ourselves well hydrated is a key to great health. A quick mention of the important sources of few of these vitamins. Vitamin A, we know, is important for vision, growth and also for immune function. The important sources of vitamin A are yellow colored fruits and vegetables like carrot, pumpkin, papaya, ripe mango, sweet potato, green leafy vegetables, etc. Fish liver oil, animal liver, milk, butter, egg yolk, etc. Going to vitamin D, we know it is important. It helps in the absorption of calcium and phosphorus from the intestine and helps in the formation of bone and teeth. Although unlike other vitamins, it is not found in abundance in foodstuff. By and large, the major source of this vitamin is the sunlight, and most of our children spending time indoors. All the parents keep asking whether their children would be deficient in this particular vitamin. So let me mention that it is estimated that as little as 15 minutes in a day is adequate. Exposure to sunlight is adequate to meet the daily requirement of vitamin D. So encourage children to play in areas of homes where sunlight is available. The few of the important sources of vitamin D are fatty fish like salmons, mackerel, sardines. Some amount of vitamin D is also present in mushrooms, cheese, etc. Some of the fortified cereals, orange juice and soy also contain good amounts of vitamin D. This is one vitamin which you could discuss with your pediatrician to find out if children need supplements, because its supplementation depends upon whether the child has insufficient levels or deficient levels. Then moving on to zinc, which has garnered a lot of importance. The important function of zinc is also for growth, development and maintaining a healthy immune system. Important sources of this vitamin are meat, liver, especially shellfish, spinach, mushrooms, nuts, legumes and whole grains. And a lot of parents have been asking about probiotics. Curd by far is the most important probiotic. Other fermented food like idli, dosa also have probiotics. Green peas and cottage cheese are also some of the sources of probiotics. Having said all this, I would still reiterate and emphasize on the rainbow nutrition for maintaining good health and robust immune system.
Telemedicine is being spoken about in recent times. Can you give us a fair idea about what is telemedicine and how does it work?
Telemedicine was started in our country with the purpose of providing specialist healthcare services, especially to the remote areas of our country where a specialist or a tertiary healthcare facility is not available. Teleconsultation and online consultation are forms of telemedicine which have been made legal, recommended and encouraged by the Government of India, particularly during these pandemic times. It is done with the purpose of reducing the risk of exposure to otherwise healthy individuals, and it has also helped us with transport logistics during the lockdown. Some key points to make a note of. Ideally, to consult your regular pediatrician. He or she would know the child's history better. To take an appointment for this as well. You can avail an online consultation via a WhatsApp, a video consultation, or a telephonic consultation depending upon your doctor's practice. Consultation for simple ailments of short duration are recommended. Where possible, take pictures of the throat, of some skin rashes or injuries or eye, and record sounds of cough, etc., which you could share with your pediatrician, and it could help them diagnose better. Doubly ensure that the drug prescribed and those dispensed by the chemist are the same. Well, if symptoms worsen, it is advisable not to go in for another online consultation but to visit the doctor at the healthcare facility. It is also mandatory that you reveal details of travel, contact with a suspected or a COVID positive person, or with any other person exhibiting symptoms of cold, cough and fever. And it is also advisable that you inform the doctor of any other visit to a healthcare facility.
Doctor, how do we help our young ones cope with such situations where they have to stay indoors, abundance of screen time, and how do we as a family stay calm through it all?
Parenting in itself is a task, and parenting during the pandemic, definitely a challenge. Children rely on their parents for both physical and emotional support. Hence, telling your children that you are there for them and that you and your family will get through this together. Answer questions about the pandemic simply and honestly. Give them age-appropriate explanations. You can filter news as it could get worrisome at times. It is all right to tell them that people fall sick. At the same time, telling them that maintaining certain routines like hand washing, covering your face with a mask, maintaining a respiratory hygiene and cough etiquette, etc., will help in keeping them safe and healthy. Find out what worries them the most, and in a calm and reassuring voice address those issues. Apart from stories of grief and sickness, you must also tell them stories of courage, strength and kindness exhibited by our citizens, by the frontline COVID warriors and the healthcare professionals. Also discuss their role and contribution in keeping our country safe. Tell them that by staying home and following rules, they're helping in reducing the transmission of the disease. Keep in touch with the other members of your family, their siblings, their grandparents, or their friends via a video chat. It not only connects them to the outside world, but it also reassures the children that their loved ones are safe and that not everything is as dangerous as it seems in the outside world. Tell your child when you're leaving home for work or for some essential errands, please tell them how long you're going to take, where you would be going, and that you are taking enough precautions to be safe. Looking forward, also tell them that scientists and the healthcare professionals all over the world are working tirelessly to see how they can help the sick get better, and that they are trying to find out a lot of new drugs and treatment that could probably reduce the severity of the disease, and that things will soon begin to get normal. Most importantly, the X's and the O's, that is the hugs and kisses and saying I love you more often than ever will work wonders. All said and done, not all children would respond the same to parental discussions or reassurances. In the last couple of days, we've had a lot of children come to us with bedwetting, vague complaints of stomach ache, headache, body ache. Children appeared excessively quiet, sad or lost, unhealthy eating and sleeping habits, loss of appetite, difficulty with attention and concentration, avoidance of activities that they'd enjoyed in the past. So if parental reassurances don't help, I think it's better that you seek professional help.
Doctor, any parting advice you would like to give our parent community?
With the fourth lockdown further easing out most restrictions, the reopening of the international travel for stranded citizens, the interstate movement, etc., and the understanding that the virus is not going anywhere. So letting guard down now will definitely spell trouble. In fact, we will have to be more vigilant than ever. We have empowered ourselves with fairly good amount of knowledge about the virus transmission and how to protect and keep ourselves safe. So be it the fourth lockdown or post-lockdown, we will continue our fight with this virus. We will continue to carry forward all that we have lived and learned in the last 2 months. So let me reiterate it yet again. Maintaining social distancing, using a face mask or a face covering, the right technique of hand washing with frequent hand washing, maintaining a good respiratory hygiene and cough etiquette will help us go a long way through and out of this pandemic. So, parents, stay safe, keep your little ones safe, give them all the warmth and tender loving care that they so deserve. Thank you one and all for your patient hearing.
Thank you, Dr. Sushma Sanjay, for giving us your insights and advice to our parent community during these troubled times of COVID. And a big thank you to all the doctors out there for being our frontline COVID warriors. Thank you.